We're excited. We're going to roll into ECHO's work, really signifying and improving the cancer care worldwide. The work that we've been doing, it's been groundbreaking. And first today, to talk about that, we want to invite Dr. Terry Vick of Indiana University, IU, so that he will share his ECHO story with the rest of us. Then we'll get a chance to hear from a world-class cancer panel. But without further ado, Terry Vick. Thank you.
Thank you. Well, thanks for inviting me this morning. I'm going to talk a little bit about a question that drives me every day. What does it take for a child with cancer to be cured? A couple of years ago, a 10-year-old boy in the community in rural Kenya was beginning to develop fevers every once in a while, some swelling in his abdomen. He just wasn't feeling right. He went to the dispensary and the clinic and got some medicines for worms, some others for malaria, and after a few months, he ended up getting referred to the county hospital. Luckily for him, the county hospital had clinicians, pediatricians, other healthcare workers that participated in our bi-monthly pediatric oncology echo. They immediately recognized that what this boy had likely could be a cancer. They couldn't diagnose it, they didn't have the technology to do so, but they knew who to call, how to make that referral, and so we arranged for that boy to get transported to our center in Eldoret, Kenya. Now, there we made a diagnosis of Burkitt lymphoma, and he was able to start treatment. Back in 2010, when I first started going to Kenya, that story wasn't even at all possible. We had this huge disparity in the children who might have cancer compared to the numbers who actually made it to our facility to get diagnosed and even have a chance to get treated. And that was a huge problem at Moy Teaching and Referral Hospital where I've been working now for the last 13 years. With that problem in diagnosis, it was even affecting our hospital itself in the sense that a child could sit on our wards, he could be waiting weeks, literally months, to get the right test, to get a diagnosis, to get a pathology report that told us what he had and how we could make his diagnosis and then eventually start his treatment if he was still alive to get to that point. So it was a rough time, but it was a challenge. Shortly after that, we had begun having my arm twisted. These two stories kind of illustrate the potential for what ECHO can do to improve low and middle income countries to get access to knowledge and gain experience in treating childhood cancer. So I'm a pediatric hematologist oncologist by training. I've been caring for children with cancer for 40 years now. Back in 2009, my cancer center director, Pat Lehrer, twisted my arm to go to Kenya and help with the effort to improve childhood cancer care. We work with an organization called AMPATH, which is an organization that includes Indiana University and a number of other North American centers, along with Moy University and Moy Teaching and Referral Hospital in Western Kenya. That program initially started 30 years ago to address the HIV/AIDS pandemic, but over the last 15 years, it's morphed into an organization that focuses on universal health care and coverage of entire populations and counties in Western Kenya. And a small part of that care then is children with chronic diseases, such as non-infectious diseases, such as cancer. And then in the past decade, we've actually made great strides in improving the care of children with cancer. We got chemotherapy stocked in the hospital. Simple thing, but makes a big difference. We got all of the children consolidated into a single ward in the hospital where all of the children could get treated for their cancer. They could all get the shared expertise of nursing, pharmacy, the medical staff to improve their outcomes. We also got kids enrolled in the National Health Insurance Fund that cost families about $4 a month to participate. Now that was a big advantage because that insurance fund would now cover chemotherapy that was in the hospital so that the families didn't have to go out to the community and buy it and bring it in. The National Health Insurance Fund also started to pay for CAT scans for diagnostic testing, and we converted a old machine that was used for measuring certain blood cell counts in patients with HIV. We converted it to become a leukemia and lymphoma diagnostic tool. So all of these advances made a big difference in the care for children, but they still didn't address the primary problem of getting kids in the door to be referred. The old model healthcare referral system in much of Africa, including Kenya, was that if you had a patient that you didn't know what was wrong, well, technically you're supposed to have a diagnosis before you can refer them on. But if you don't have the technology to make a diagnosis, then you're stuck. And eventually the child gets sicker and sicker, and then you just give up and send them and hope someone sees them and gets them better. So there really had to be a better way. And I thought maybe potentially Project ECHO could fill in that role. So back in January of 2019, I first heard about ECHO. I did my immersion training and came to the last MetaECHO in March of 2019. And then in September, I was going to be in Kenya for 9 months on a Fulbright Scholar Award where I could set up our ECHO program, and we launched in January of 2020. And these are all the areas where we serve in Western Kenya, quite a large area with 10 million children included in that coverage area. So our hub team, we enlisted all of our Kenyan partners in Moi Teaching and Referral Hospital. We had done a needs assessment that was published by my colleague and Tyler Severance and our team to show that providers in the community really wanted knowledge. We had surveyed participants in our annual pediatric oncology conference in Eldoret, and we knew that it was a big need. So we enlisted Dr. Festus Juguna and Dr. Gilbert Obara, pediatricians who had a strong interest in pediatric oncology and were the first two fellows in our pediatric oncology program. With their help and leadership, we made a hub team of pathologists and nurses and other healthcare workers and really had a lot of enthusiasm to launch. Now, Moi University trains pediatricians and had been training pediatricians for 20 years, and those pediatricians would go out into the community, into their county hospitals. And now in that situation, they became the secret sauce, people that we knew in the community that we could recruit in as spokes to make this ECHO successful and show that we could really have an impact in making the referral process that much easier. So now that we've been running our ECHO for 3 years, We've had a large number of sessions. We've tripled the number of children who have been diagnosed with cancer in our center. We've brought them into care. We have a WhatsApp group that facilitates communication between sessions so that the providers have someone to contact if they have a question about a child with possible cancer. And I think all of those things have really improved the potential for care. This last month, an 8-month-old girl was presented at our echo. She was noted to be pale, was a little lethargic. The clinicians noted an enlarged spleen. So they sent her to the county hospital. They immediately did a blood count that showed that her white blood cell count was high, that she had anemia and low platelet count, all indicators of leukemia. They called, they referred her. Within the next day, she was in our center with a formal diagnosis and starting treatment. It's stories like that really show how much enthusiasm there is for ECHO in our community. When I started this journey, 1 child in 10 of the few patients who could make it to our hospital could be a survivor. In the last 3 years, with the hundreds of extra kids that have been diagnosed and sent to our center, more than half of them are now survivors of their cancer. So I think it just shows the power of ECHO to get kids into care. And I think the enthusiasm of the local team, the community that we've built in the periphery and the county hospitals, all contribute to allowing those kids to kick their cancer. So thank you for their attention.